اليوم بقول لكم قصة عمليتي الزايدة. طبعا في ذاك اليوم أتذكر جاني ألم غريب تحديدا هذا المكان، وكان ما يجي إلا مع الحركة، وبما إني عفريت طول الوقت تتحرك فكان ذا الشي ضايقني. طبعا فكرت واللي يعتبر شي نادر من قبل، وقررت إني أبحث بجوجل، وعاد نتائج جوجل كانت تقول لي فيك إيدز وسرطان وجاي يقطعون في الطريق وراح تموت من شاحنة. ايش دخل الشاحنة؟ لا بس يعني عشان تضيف أكشن شوية. رحت بعدها سألت أبوي، وكانت ردة فعله زي اللي الله يكون عندك زايدة. وأحلى شي جاء ولد أختي مطفي النور قول أنس عندك ولد في بطنك، يحسبني حامل.
How are you, doctor?
I'm fine. What's the matter with you?
My friend has appendicitis. Can you tell me a little about this disease?
Good. Appendicitis is an acute inflammation of the appendix. Classified based on complexity. Uncomplicated, more than 70% of cases, no involvement of the peritoneal cavity and no abscess. Complicated, involvement of the peritoneal cavity and presence of an abscess. Classified also based on severity. Mild, not critically ill with no signs of sepsis or septic shock. Severe, critically ill with signs of sepsis or septic shock.
Well, how do I know that I have appendicitis? What are the symptoms?
Symptoms of appendicitis are acute abdominal pain, usually located in the right lower quadrant, nausea and vomiting, fever is greater than or equal to 38.0 degrees Celsius and may be absent. Hypotension and signs of organ hypoperfusion is reduced urine output, release of pressure on the abdomen and abdominal muscular tensing.
Okay, doctor, I understand, but what can cause this disease? What are the causes?
The most common pathogens that cause appendicitis are gram-negative bacilli, streptococcus, enterococcus, and anaerobes from the intestinal microbiota.
Well, what tests can I do to detect the disease?
Microbiology tests not used in mild cases but may be needed in severe cases to guide antibiotics. The tests are 1. Blood cultures, detects bloodstream infections. 2. Abscess fluid culture, identifies bacteria or fungi for targeted treatment. And to assess infection and disease severity, we do white blood cell count, indicates infection. 2. C-reactive protein, detects inflammation. 3. Procalcitonin, helps guide antibiotic use.
Yes, I understand. So what is the treatment for appendicitis?
We treat with antibiotics and their duration varies. In uncomplicated cases, antibiotics can stop once the appendix is removed. Complicated cases, continue antibiotics for up to 5 days if symptoms have improved and the infection source is managed. General antibiotic course, typically 7 days if clinical monitoring is feasible and recurrence risks are managed. In mild cases, first choice, we give amoxicillin plus clavulanic acid IV or oral. Second choice, ciprofloxacin oral combined with metronidazole. In severe cases, first choice, cefotaxime or ceftriaxone IV combined with metronidazole. Second choice, meropenem IV only if there's a high risk of infection by resistant bacteria.
Thank you, doctor, for this wonderful information.
You're welcome, Ahmed.